Thank you, organizers, for inviting me to give this opportunity. I would like to discuss with you today about the role of government in improving self-sufficiency in organ transplantation. Today, I would like to discuss firstly, to which degree your government should involve in transplantation, and secondly, in order to improve self-sufficiency in transplantation, what would be necessary? For this, I did some literature review, and I have done some email exchanges with these 12 experts in transplantation, 5 of them from most prepared and 5 of them from more prepared countries by Global Health Security Index. Also, I reviewed the result of the third global consultation on organ transplantation, which has been held in Madrid 2010, which has been published in Transplantation 2011. The Madrid resolution can be summarized like this. So the role of the government can be categorized in 3 different groups. The first one is increasing organ availability, and the second one is ensuring fairness, justice, and transparency, and the third one is preventing the needs for transplantation. Today, I would like to talk about the first 2 things, increasing organ availability, and the second, ensuring fairness, justice, and transparency. As you know, a transparent and efficient governance structure to optimize growth in organ donation, organ retrieval, and transplantation is the essential part of organ transplantation in self-sufficiency, and the national accountability can be categorized in 3 different groups. The first, capacity control; second, regulatory control; and the third one is ethical context. The first, national accountabilities in capacity management means development of an adequate and appropriate healthcare infrastructure and workforce, and adequate and appropriate financing. National accountabilities in regulatory control contains adequate legislation, regulation covering procedures, and systems for monitoring and evaluation. National accountabilities in the ethical context means national authorities need to lead normative change from perception of organ donation as a matter of right of donor and recipient to one of responsibility across all levels of society, meeting the needs of patients while avoiding the harm of transplant tourism and commercial donation from living persons. That means consistent with WHO guideline principles. So we can say the mission of government in organ transplantation have 2 missions. The first, establish legislative and regulatory framework, and the second, establish national agency, or we can call it National Transplant Organization, NTO. And congratulations for Mongolian friends that you made RDT-TOT and make progress in this field. The first mission of the government of legislative and regulatory framework means the legislative framework should contain determination of death and legislation concerning organ trafficking and establishment of NTO and the basis of consent, that is opt-in and opt-out, and the governance of organ procurement and fair and transparent allocation and proper data collection like a transplant registry. And the regulatory framework should contain all kinds of medical activities in transplantation as well as ministry regulation. When we reviewed the organization system of national authority in WIPRO countries, fortunately, most of the countries, including Mongolia, has all requirement of legislation and regulation. Then, how can we improve self-sufficiency in this situation? In legislative and regulatory point of view, the first one will be mandatory disease donation or presumed consent. If it's not working, probably adopting first person authorization law. And the second one will be mandatory reporting of possible deceased donors. The second mission of the government is establishing national authority. And the role of the national authority is regulating donation and transplantation activities, maximizing donation from deceased donors, and protecting the well-being of living donors. And as you see, the best model of Spain of ONT says the support of the Spanish government to donation and transplantation is crucial. When we reviewed the Madrid resolution, Luc Noel suggested that we need at least 3 operational structures or organizations and 2 regulatory structure and organizations. For operational requirement, healthcare infrastructure and organ procurement organization and the transplantation coordinating authority of allocation and waiting list control is needed as a structure or organization. And for regulatory requirements, regulatory authority and the donation and the transplantation registry is needed under the legislative framework. Among those, I think the regulatory authority plays the most important role. The regulatory function of national agency includes oversight of standard, practice, and performance, provide criteria and guideline, and certify or authorize transplantation-related process and organizations, as we are learning from Spanish model. The regulatory function should cover oversight, monitoring, and evaluation of a hospital, OPO, and allocation and waiting list and registry, not only their performance and reporting, but also their compliance with ethical principles. And also the regulatory function should include provide criteria and guidelines for every procedures and processes and criteria, and should do the fair certification and authorization process, and also cover the reimbursement. Then what would be necessary to improve self-sufficiency in the field of regulatory role of NTO? That is the donor coordination network supported by national authority, and training on donation and donation for professionals to participate the process, and other programs such as the quality assurance program and coordinating the relationship with the media, as Beatrice has suggested, and you will hear a lot about good information from Beatrice today. And I think reduce the financial burden of donor should be included to improve self-sufficiency, because if the donor is under the pressure of financial burden, that will eventually reduce the proportion of organ donation. For donors' financial burden, of course, the donor and to organ donation needs medical cost. And as you see, this table, procurement expenses covered by sometimes state, sometimes insurance, sometimes from recipient, sometimes by others. And as far as I know, in Mongolia, the government pays for donors. And then what should be included in reimbursement, a Declaration of Istanbul approved the followings. The first, the cost of any medical and psychological evaluation for potential living donors should be reimbursed, and also cost included in arranging and effecting the pre, peri, and post-operative phases, and the 3, medical expenses incurred for post-discharge care, and 4, lost income in relation to donation. In Korea, only 1 and 3 are covered, so 2 and 4 is not covered. So in Korea, lost wages and travel expenses, and long-term health care maintenance fee, and also incensors such as housewives' choruses is not covered, and potential disadvantage in future insurability is another big problem for living donors, and that kind of cost should come out of pocket cost from the donor side. Not only in Korea, the recent paper says in Canada also has a lot of out-of-pocket costs, which will really decrease the number of potential donors. So it is really needed that the cost of recovery under good regulatory compliance is needed to minimize donor financial burden. As you see here, like Canada, like generation of best practice guideline in billing for living donation, it will be needed soon. For deceased organ donation, DICJ group has reported the issues regarding payments to families of deceased organ donation in 2016 by Professor Capron et al. In this article, for deceased organ donation cost-wise, countries with successful disease organ donation program, government usually pays, including Mongolia and France and Spain. In case if the government is run out of money, then what is going to be happen? For countries have no or insufficient government support for donation-related expenses, then who is going to pay for disease organ donation-related medical expenses, which is not that cheap? Then who will pay? In Korea, at the beginning, the recipients paid, and then it took a long time, the recipient hospitals paid, and eventually the national health insurance is paying now. In other point of this is the donor financial burden issue is some countries in the Middle East, Asia, and America, we can see the funeral cost or other hospital expenses are financially paid to the donor family because involved person think without such financial incentives, sufficient organ would not be donated, or like Korea, we think appropriate, it's financial compensation is an appropriate reciprocity for the family's gift to the community. But it was decided that it was outside the circle of ethical transplantation practice. And Mongolia, no financial incentives related to organ donation has been documented, but Korea, the government pays funeral condolence money to the donor families. Then is that financial incentives can increase the disease organ donation. For this, in Korea, when we started monetary support, when we started the KONOS system in 2000, even with the monetary support, the disease organ donor numbers were actually decreased. It's only after that we developed the system, including quota and obligatory reporting system, the number of deceased donors start to increase. So giving next of kin money does not produce the highest donation rate, as we published in Transplantation in 2015. But we also think we should express our thanks to the donor family for their difficult decision as a member of the society, and we feel it is as a social responsibility. About that, when we started do the funeral condolence money to the families, some families get struggle because there was a dynamic that who is getting money or not, and also some families were not happy because their goodwill has been reimbursed by monetary way. So developing memorial park and developing activities for donor families for their condolences will be very important to increase the organ donation in each country. Next structure is donation and transplantation registry, and that's for monitoring and surveillance and operational support and outcome prediction and resource of transplantation research. And that should include 4 different categories of living donors, deceased donors, transplant candidate, and transplantation recipients. And not only the demographics, but also should include relationship to recipients or country of residence, as well as donor card and the donor status of potential eligible and actual utilized donor and the cause of death. And also, we would like to have initial data including the BDD and DCD and standard marginal extended donor type, as well as follow-up data of psychological complications, as well as medical complications. And our abstract program will be happy to provide the computerized platform to all of Mongolian friends if you need. Linking data to the waiting list and allocation system will be done already, and the merging data with national health database will increase the data accessibility and reduce the error, and linking annual transplantation data to global databases such as GODT will increase international collaboration as we provided the abstract platform. And because of international collaboration is important, because the donor and recipients are traveling all over the world, so global data for transplantation tourism is very important to understand the current situation. So DICG already provided the platform, and the data for current issues for such as COVID-19 has been also provided by different groups. And transplantation coordinating activity of allocation and management will be also crucial, and how to improve the self-sufficiency for this system includes traceability and equal accessibility and the compliance with allocation rules and policies of utility, justice, and respect for persons. The healthcare infrastructure and everything you know, then how can you improve the self-sufficiency? That includes using expanded criteria donor management and donation after cardiac death management, also capacity building for ABO incompatible transplantation and transplantation for hypersensitized patient. And organ procurement organization will be another very important organization in national self-sufficiency. And the first role of organ procurement organization is provide guidelines for organ donation and procurement process of each step which will be very helpful if you can develop the critical pathway for each step. The second role is maximize organ donation from deceased persons. That includes develop and maintain highly qualified organ procurement professionals, and that we have been called coordinators, and provide adequate education for OPO professionals. And other than that, to improve self-sufficiency, Korea has established the CODA, that is an independent organ procurement organization to activate organ donation from non-OPO hospitals and maximize utilization of donated organs. ONT has suggested new strategies to increase organ donation of ICOD, intensive care to facilitate organ donation, and ECD and DCD, and pediatric donation and participation of private healthcare sector. Hospital survey system of medical record review and hospital attitude survey represented by donor action also can improve self-sufficiency, and also the program to have an early stage donor identification program like a DIP, donation improvement program, will be quite important to get more report for possible deceased donor in Korea. This is probably we are covering all kinds of structures and organization that has been suggested by the previous Madrid meeting. And while we are building our Korean system under the guideline of this Madrid resolution, we found two more structural organization is needed. The one thing is because there are so many organizations needs to work together, with that coordination and policy structure is needed. And the second one is we probably need public awareness and education structure. For public awareness structure-wise, I think Mongolia has been done wonderful work to make public aware of life sharing's importance, not only but doing campaigns, but also doing medical education and public media interaction and communicating with the government. This kind of public awareness can be done by government-driven like Spain, that's systematic and reliable. But sometimes countries like US and Korea is using NGO to drive this. That has the advantage of self-starting and the promptness. In Korea, Korean Society of Transplant has been established. The VitalLink, this is an NGO, as all of you know, and has been performed different kind of activities for past 10 years. So the government of KONOS and KODA has been done very, very important work for public awareness, but we have done lots of activities to promote public awareness. One of the most important issue for our VitalLink is starting education for students, not only high school students, but also medical students. And the medical staff and donor family education has been done by KODA until now. So we have generated online as well as offline education platform so that they can really understand the meaning of brain death and meaning of life sharing. Not only that, to improve self-sufficiency, we have been working on oversight over online and offline contents, because there are so many false information regarding organ donation. And also we have been tried to make a network to international counterparts and also Korean eye and tissue organ donation organizations to share our experience and share our materials. The other structure that we would like to suggest is the policy and strategy for self-sufficiency to maximize organ donation from deceased persons because the high level of government policy and development of transplantation service is quite essential to overcome the barriers between different government bodies and community bodies. So like you see in Australia, made every structures, evaluated every structures and function and make a roadmap to improve the disease organ donation. And Philippines and other countries has established the organ donation system development for COVID-19 era. And I would like to congratulate all of Mongolian friends who worked very hard to develop disease organ donation and transplantation program, which is so successful now. Then what will be needed to improve self-sufficiency in policy and strategy issue? I think global living donor protection. Donor protection is very important because one donor get wrong, then you will lose lots of donors in consequence. And also health equity in organ transplantation should be kept in mind. So for donor protection, like US, they do develop independent donor advocate, that's another coordinator, nurse, or volunteers who can see the donor as a donor side benefit. And the other one is a donor should be provided lifelong medical and psychological follow-up and care so that they can be confident to be a donor. So from every step of organ donation, from evaluation and after donation and after their life, they should be supported not only medically but also have evidence through living donor registry and should have solutions for follow-up deficiency and try our best to protect the vulnerables. Health inequity is another problem. So some people, the organ transplantation should be provided under the scope of health inequity. That's another huge challenge for our society. Like India, where health inequity is a significant problem, they developed Ma Yojana project for below poverty line population, and also Ma Bachaya Yojana, which can cover low to middle income class families as well. And if it's not available, there are several prime minister-based funds to support, to overcome health inequities in organ transplantation in India. So, in summary, to improve self-sufficiency, we need structure and organizations of healthcare infrastructure, organ procurement organization, and public awareness and education, and waiting lists and allocation under operational requirements, and also a regulatory authority, coordination and policy, and the donation and transplantation registry organization is needed under regulatory requirement, and all of these should be controlled by fair and transparent legislative framework. So in each section, legislative and regulation part, mandatory disease donation or person to consent system, mandatory reporting system, and the reduce the financial burden system is included. And first, system-wise, national independent OPO through education and maintenance of good coordinators, and transplantation registry, which also contains global collaboration issues and the long-term follow-up of living donors, and education of organ donation in high school as well as medical school, and committees for transplantation policy and coordination, and non-monetary rewards for deceased donors and their family will increase self-sufficiency, I think. And program-wise, develop critical pathways for each step will be important, and improve donor identification through donor action, death audit, or early referral system will improve the self-sufficiency and utilize organs from DCD, ECD, and ICOD. Also, allocation rules for maximizing utilization and introducing paired kidney exchange program would improve our dream of self-sufficiency, I think. I would like to express my thanks to the participants giving me the valuable opinions about self-sufficiency, and also I would like to thank the participants of Third Global Consultation on Organ Transplantation at Madrid 2010, which gave me a lot of valuable information on self-sufficiency. I would like to thank again the participants and organizers for this successful conference, and I really hope the Mongolia make great progress in disease organ transplantation by reaching self-sufficiency. Thank you for your attention.
네, 됐습니다. 수고하셨습니다. 선생님 마지막 장에서요.
네, 제 사진 안 들어가도 돼요, 여긴.